Hello, my name is Dr. Дэвид Лю. I'm one of the physicians at EVA Vein Care. We put together a short video to outline the VenaSeal procedure for all our prospective patients as well as for people who are interested in this therapy. We first begin with an ultrasound examination of the leg in a standing position. Following that, we perform a small injection of local anesthetic, very similar to what you would feel if you were to go to a dentist's office and have a filling done. When we achieve the appropriate anesthesia, we use the ultrasound machine to guide in a very small needle and subsequently a wire. This is then transitioned into a larger sheet that you see here with the orange cap and white base, which allows us to then access the blood vessel that we need to treat with a VenaSeal system. The blue catheter is then introduced into the blood vessel, and we use a combination of ultrasound as well as feel to be able to identify the blue catheter going up into the varicose veins. When we can identify the appropriate spot for the varicose vein treatment, we then draw up the VenaSeal adhesive, the cyanoacrylate. Here you see us drawing the cyanoacrylate up, and as you can see, it's very thick and viscous, very similar to a very thick honey. This type of adhesive can stick to everything and needs to be handled very carefully. So we use meticulous techniques to make sure that we have everything clean and sterile prior to the injection, as well as ensure that none of the adhesive is actually leaking outside of the catheter. After we draw it into the syringe, we then interface it into the dedicated catheter, which is the long narrow tube for injection in the vein. We prime the catheter with the administration gun, which looks a lot like a caulking gun. And what that allows us to do is to slowly administer very small amounts of the cyanoacrylate, the VenaSeal adhesive, into the blood vessel as we simultaneously compress. Here you can see us pumping the handle a few times, and you can see how little glue or how little cyanoacrylate actually goes into the blood vessel. Under controlled environment, we then inject a small amount of the glue and pull back the catheter and literally compress the veins together. You may feel a little bit of pressure here. When we compress the vessels together, they literally get glued together. And we do this through the course of the vein, which takes about 10 minutes. When we're approaching completion, we then pull the white sheath out from the skin entry site. We then very carefully put in the last parts of glue within the blood vessel and pull the catheter out. Here you can see us removing the catheter with a little bit of compression and a little bit of pressure just to make sure that the veins close off. Once we finish with the compression, all that you're left with is a small skin nick about 3 millimeters in diameter that heals very quickly. And as you can see here, all we have to do is just apply some small bandages. Now, you may not notice an immediate resolution of your varicose veins, but this has eliminated all of the pressure within the veins of your legs in order to ensure an appropriate healing process. Thank you very much for your time, and I hope this helps.